Diabetes is a condition that affects how the body uses glucose, a type of sugar that is the main source of energy for the cells. Here are some sentences that cover the topic of diabetes symptoms and treatment. Diabetes can be classified into different types, such as type 1, type 2, gestational, and pre-diabetes. Type 1 diabetes is an autoimmune disease that destroys the cells in the pancreas that produce insulin, a hormone that helps glucose enter the cells. Type 2 diabetes is the most common type of diabetes and occurs when the body becomes resistant to insulin or does not make enough insulin. Gestational diabetes is a temporary condition that affects some pregnant women and causes high blood sugar levels. Prediabetes is a state where the blood sugar levels are higher than normal but not high enough to be diagnosed as diabetes. Some of the common symptoms of diabetes are increased thirst, increased hunger, frequent urination, weight loss, fatigue, blurred vision, slow healing wounds, and infections. Some of the symptoms that are specific to men with diabetes are erectile dysfunction, low testosterone levels, and decreased sex drive. Some of the symptoms that are specific to women with diabetes are vaginal yeast infections, urinary tract infections, polycystic ovary syndrome, and menopause-related problems. The diagnosis of diabetes is based on blood tests that measure the level of glucose in the blood. The main tests are fasting plasma glucose test, oral glucose tolerance test, and hemoglobin A1C test. The treatment of diabetes depends on the type and severity of the condition. The main goals of treatment are to keep the blood sugar levels within a healthy range and to prevent or delay complication. The treatment of type 1 diabetes involves taking insulin injections or using an insulin pump to replace the insulin that the body cannot make. The treatment of type 2 diabetes involves taking oral medications or injections that help the body use insulin more effectively or stimulate the pancreas to produce more insulin. The treatment of gestational diabetes involves monitoring the blood sugar levels and following a healthy diet and exercise plan. Sometimes, insulin or oral medications may be needed as well. The treatment of prediabetes involves making lifestyle changes such as losing weight, eating a balanced diet, exercising regularly, and quitting smoking. These steps can help prevent or delay the onset of type 2 diabetes. A healthy diet for people with diabetes should include foods that are low in sugar, fat, and salt, and high in fiber, protein, and complex carbohydrates. Some examples are fruits, vegetables, whole grains, lean meats, fish, nuts, seeds, and low-fat dairy products. A regular exercise routine for people with diabetes should include aerobic activities such as walking, jogging, cycling, swimming, or dancing. These activities can help lower blood sugar levels, improve blood circulation, reduce stress, and maintain a healthy weight. People with diabetes should also monitor their blood sugar levels regularly using a glucose meter or a continuous glucose monitor. This can help them adjust their medication doses, food intake, and physical activity accordingly. People with diabetes should also have regular checkups with their healthcare providers to assess their condition and prevent or treat any complications. Some of the tests and exams that may be done are blood pressure measurement, cholesterol test, kidney function test, eye exam, foot exam, dental exam, and nerve function test. Some of the possible complications of diabetes are heart disease, stroke, kidney disease, nerve damage, eye damage, foot problems, skin problems, hearing loss, depression, and dementia. Diabetes is a serious but manageable condition that requires lifelong care and attention. By following a treatment plan and making healthy choices, people with diabetes can live long and fulfilling lives. That is a very true statement. People with diabetes can live long and fulfilling lives by following a treatment plan and making healthy choices. Some of the healthy choices that people with diabetes can make are: eating a balanced diet that is low in sugar, salt, and fat, and high in fiber, fruits, and vegetables. Being physically active for at least 30 minutes a day, 5 days a week. Checking their blood glucose levels regularly and taking their medications as prescribed. Quitting smoking and limiting alcohol intake. Managing stress and getting enough sleep. Seeing their doctor regularly for checkups and screenings. These healthy choices can help people with diabetes prevent or delay complications such as heart disease, kidney disease, nerve damage, eye problems,